Namaskar viewers, hello and welcome to this special episode of Healthy India. I am Teena Jha. Over the last 2 to 3 years, the COVID-19 pandemic and its aftermath has highlighted the importance of a robust public health system in the country. So although there have been several efforts to make healthcare accessible and affordable in India, given the population, the limited resources and newer health crises, there is no doubt that a lot more needs to be done to improvise the healthcare systems in the country. Only a healthy nation can contribute to a prosperous nation. So what measures can we expect Finance Minister Nirmala Sitharaman to announce for the health sector? What are the experts in the sector expecting from the budget this year? That's what we will focus on in this edition of Healthy India. To talk about the pre-budget expectations, the challenges given the fiscal reality of the country, and the reformative measures that our healthcare sector urgently requires to make the systems more robust and resilient, I'm joined by two special guests, Dr. Rakesh Kumar Srivastava, former Director General of Health Service, Government of India. Dr. Srivastava, thank you for your time. Welcome to the program. And Dr. Suneela Garg, Chair Program Advisory Committee, National Institute of Health and Family Welfare. Dr. Garg, thank you for joining us on the program. Thank you for your time. Let me in fact begin the program today with you by understanding from you what are your expectations from the budget this year. What are the kind of measures that you expect the Finance Minister to announce this time? Given that we've been through the pandemic 2 to 3 years, we have recovered much faster than anticipated, but the kind of attention that the healthcare sector now requires.
Thank you so much. It's a very, very important question that we are, very closer to, the budget announcement, and there are, I think it's health which is one of the most important thing. Along with health, I'll also say it's wellness component also we need to focus upon. So pandemic has taught us, how fragile, our healthcare system is, across, it's not only in India but across the world. But when, we talk in Indian context, we are very soon going to cross over China. So it's all the more very, very important that we need to focus on our health systems which reach the last mile. So automatically when we focus upon the infrastructure, we focus on the service provision, we focus upon, system strengthening, which is one of the most important thing, which has got again the 6 building blocks, right from leadership governance to supply chain management to along with, basically capacity building, our strengthening of health management information system, everything requires, budget. And we need to see that, our budget is to the appropriate, right now we don't have even 2% of our, GDP. So we need to substantially invest in our, healthcare systems so that, we are able to have accessible and affordable healthcare. And another very important thing is that apart from this, we need to have a focus on our preventive and promotive part, which, should require a major chunk of our budget. On paper, we do have, yoga, Ayurveda and all these systems, but we need to put them into practice. And it's not only about the budget part, how much it is sanctioned, but utilization part also becomes very important.
Clearly. So how much are we able to utilize is something that I'll take the question to Dr. Srivastava. The fact that, there is constant need and demand from experts in the industry to increase government spending. The National Health Policy also talks about the importance of increasing government spending on infrastructure, on health to about 2.5% of the GDP. But the fact is, how well or how wisely are we spending the amount that is actually being allocated? Since you've been associated with the system for so long, give us and our viewers an insight about how we are able to utilize the funds that the government is allocating to the health sector.
Thank you, Teena. First of all, I would like to say that it is a very timely discussion, and pandemic has put health in the forefront. So expectations are high.
Absolutely.
And with the deficit economy and deficit financing system, we do not expect that in one go we will get everything. It will be an incremental thing. But as far as the utilization or spending of the budget which is allocated is concerned, normally spending is looked from 4 angles. First is whether the allocation was done efficiently, whether the fund release was real time, whether the spending which is largely done by the state government is in accordance to the health gap which they have felt in their state, and they have prioritized, they have done a priority setting exercise. And lastly, whether it has made some type of impact on the life of last mile person. So if you try to look at this and try to review the last year's spending or allocation of the government of India and state, we find certain type of disparities. The disparities are in form that there are 4 major programs which are going on. One of them is an infrastructure development program. It has about 400% hike in 1 year. The second was insurance. It was having a 100% hike. So these are the programs which do not ultimately translate immediately as a public good. They can build the asset, but ultimately the life of the last mile person is not safe. The second thing which we have seen, that although there are 100% FDI, there is very much promotion of the greenfield project, but nobody is interested in primary care. No organized sector investment is coming for the primary care. So what I am trying to convey to you, it requires not only a more budget allocation, but it also requires a type of right distribution of the budget under the head and the subhead. So the various schemes which are running, there is a scheme which is one of the priority scheme, which is Ayushman Bharat Health and Wellness Center scheme. It is dependent on 3 Ds and 1 Q: doctors, drug, device and quality. Now, unless and until there is adequate funding for it, there are initiatives with the government, but at the end of the day, a person suffering from the diabetes mellitus sitting in the near a primary health center will like to get full drug from the primary health center, will like to have all the tests done over there. He will never like to go outside the system and purchase the services from outside. And PMJAY is only confined to the hospitalized treatment. There is a distinct absence of link between the health and wellness center scheme and the PMJAY. Patients are ejecting out from the primary health center or health and wellness center, say about 10% who are ultimately going to be hospitalized and get the treatment. They should be immediately picked up, they should be hospitalized. A heart patient coming out from the primary health center should be able to reach the empaneled hospital of PMJAY in the golden hours, for which systems are deficient. So these gaps need to be addressed, strengthened as the gap realized by the fund, realized by the states and invested properly. So that is going to increase the spending efficiency, ultimately leading to a public welfare to the last mile of person.
Clearly,
That is what is needed.
and the need is to plug these gaps if we want to make our healthcare system robust. Taking on from what he said, that it depends on 3 Ds and 1 Q. Quality is something that, of course, until we strengthen the 3 Ds, quality cannot come. Let's begin with the doctors. We have a massive shortage of doctors. So when we talk about a growing population, which is going to be a boon for us in terms of the demographic dividend, it's also a challenge because we need to cater to their demands, to their needs, and healthcare being the foremost. It's going to be a huge challenge. If we do not have enough doctors which are in proportion to the population, it will always be a problem. So are there any steps that we are actually undertaking to ensure that this ratio, at least if not in proportion, is at least satisfactory, at least we are able to do something better than the current situation?
See, one of the steps, which has been taken is also to increase the number of medical colleges and medical graduates which are coming out. But you see, the major, challenge is also the skewed distribution of the providers. Right. So that is how, the government came out with the system of mid-level providers, who are there, whom we call them as community health officers, who are sitting at the health and wellness centers and all that. So that's why it is more important is to make sure not only the production of the doctors, but it is also availability of the doctors, so that they are linked to the last mile. Though we have got telemedicine and all those services, but it is very important. The physical contact also becomes very important. So that's where we need to focus upon, not only kind of production of doctors, but also, the doctor who is having lot of skills, that is important. And that's where there have been revisions in the medical curriculum with regard to competency-based curriculum. The efforts are being made, but it will take some time. So, but the need of the hour is to focus upon that we have, adequate distribution of doctors as per our number of states and union territories, that is about 36 in number. So, we need to focus on all these areas along with appropriate linkages to the last mile. See, that becomes very important unless there is a cascade level approach, right from, when we talk to the community health center or primary health center level to the, sub-center level. So, we need to have that, and then accordingly our, worker at the last mile is also adequately empowered. So, the doctor who is a team lead will make a lot of difference, who is a skill-based doctor.
So when we talk about, establishing and strengthening these linkages, Dr. Srivastava, the fact is it's not just the money factor. It's in the manner in which we are implementing the entire policy and how it's trickling down from the top level to ensure that seamless coordination between the center and the states in the first place, and then to the sub levels, as you just mentioned. What is the root cause of the problem? Why are we not able to reach to the person in the last mile? Is it reluctance? Is it lack of awareness? Or are there, these loopholes that you suggested, which we've not been able to identify and work upon?
Health has been a very small type of ministry from ancient time. It is always low prioritized. Only pandemic this time has made a realization that health is an important ministry. Okay. So the money which was coming in past for last 75 years has been increased. 1.4 was something, I think 6-7 years back, and 2.1 of the GDP is now. So the funding is one important factor, which is to begin with an important cause, important challenge. And I agree that deficit economy, deficit funding, it will gradually increase. We cannot ignore it. The second is, we have improved certain type of allocations and given 40%, 60% type of state and central distribution. That is good. But at the end of the day, we must try to see in the government system, the biggest challenge is that there are certain plan expenditure and there are certain non-plan expenditure. Plan expenditures are carried forward. For example, I give you one example of PMSSY, establishing AIIMS-like institute. It is costing around about 16 to 1800 crores for establishing a AIIMS-like institute. And if you talk to a private person, how much it will cost, their cost calculation varies. Now, a model is created by the government budget is spent on it. Now, to carry it forward, there are large number of modes which are available through public-private partners, through viability gap funding, and this can reduce the government investment on these type of things and take it to the other areas. So, there are many other things which are in this sector, which are a continuous scheme carried forward from last year or carried forward gradually in different areas. So, there should be a rationalization of investment in the budgeting system for these type of schemes which are carried forward, which are infrastructure building. The third thing is that we say that we are online transferring the money.
So what you're indicating towards this fund, sorry to cut you short, but if you want to understand better, for the defense sector, there was this grievance that, that budget which is left over, it lapses. So they now have a non-lapsable fund, which was announced by the Finance Minister last year, to ensure that when you're talking about the capital expenditure, it remains. Is that something that you're talking about also for the health sector?
Because the government at present is allowing you to carry forward for 3 months.
Okay.
So that is not the issue. Issue is the total envelope, financial envelope which is coming to us. And second, the distribution rider under the various scheme which is attached to it for the non-plan type of expenditure, everything is being organized through 4 major schemes and there are distribution in that. So, what I am trying to convey, where we find the lesser government investment is possible, we should try to work out lesser government investment and invite partners so that they can take it up. The third thing is, that the money which is transferred to the state ultimately take 1 to 2 months to reach to the district collector where it is actually utilized. So that gap should be minimized. Once bank can reduce this gap and give you a real time transfer of the money, it can be done over here.
Okay. Dr. Garg, another problem which, a lot of people have cited, and I was going through some social media posts before doing this program, and I realized that there have been some tier 2, tier 3 cities wherein you have bigger hospitals, private hospitals, and also the government hospitals. You have the machinery because there is no problem of funding. You have the device. You don't have the skill, manpower to run that device. So maybe you are dependent on one person. That one person is not there, and that department is closed for that day with people waiting in the queue. So this is one perennial problem which has come across from a number of cities. How do we upskill people who know, because we have adopted the technology, we are buying it, and FDI has also opened that route. But now in terms of upskilling our population, we have a lot of youngsters who can be well utilized, but perhaps we are not doing it at a pace that it is required.
Definitely, it is very, very important. That's why I focused on the second component, that was capacity building.
Right.
And pandemic brought it to forefront that, we do have machines, we do have equipments, but people cannot, utilize them or operate them. So that's why it is important. But then it is also very important to see that, do we have sufficient number of people, in our public sector to do that? First of all is the skilling of these people, which must carry on at all times, because pandemics will come and go, and also our problems are going to increase. But somewhere, and under this Prime Minister's skill program, we have launched, a couple of courses also, to upskill the people, even in the, not only in the government sector, private sector, somewhere there has got to be a, this gap has got to be merged. We need to kind of come closer in terms of private-public partnerships, and where, it's not always necessary that the government is going to play a role. So private sector has got a very important role also to play in this. So if we plug in these gaps, that will be very important, and that should also feature in part of our program implementation plan. When we are planning for different, it's not only like traditional maternal and child health, we have got now huge burden of problems, whether we are talking of communicable diseases, non-communicable diseases, or cancers, and, we are talking of oral health problems, elderly care, or, looking after our intensive care, also pandemic brought us to forefront about the intensive care. So that's where we need to kind of regularly upskill our people. Even, something like yesterday or day before, it was in news about, dialysis units being opened. So, and private sector has come to forefront, the Gurdwara committee, which has come up in forefront, with the dialysis, this thing, and they are going to upscale right from just about over 100 beds to, 1200 beds in a shorter period of time. So we have got the, it's not that we cannot do it, but we have to do it with the appropriate strategy, and we need to come together on a common platform, so that ultimately, the person gets appropriate and a quality care, which you mentioned, whether it is we are talking of quality provision of services, whether we are talking of quality drugs, whether we talk of, operationalization of, all these services. It becomes very important to have a stock of both the manpower at the private and public sector and bridge them together.
Right. Dr. Srivastava, one of the lessons that the COVID pandemic taught us all is the importance of research. So we had our own, indigenous vaccines that helped not just our population, but the population of at least 100 countries to which we send our India-made vaccines. Now, going forward, the thrust has to be on, enhancing the capability of this sector. The vaccines, the India-made vaccines, they are, accessible, affordable to a wider population across the world. So one, importance to the pharma sector. And the second aspect is on health research. How much of our money are we spending actually on health research? And if not adequate, how can we take it forward? What is the kind of thrust in the times to come that is required in the field of research?
Actually, health research is an area which was which get the maximum attention after the pandemic time.
Absolutely.
Now, there are certain clear-cut realization. Number one is that the funding which is being provided for the health sector research component to build up capacity, not only to develop vaccine, but also to develop new molecules, but also to develop very many new devices that requires an extensive workout and investment from the government side and from the FDI, because this sector is very interesting for the FDI. So there are things which are being done at the regulatory level. There are things which are being done by relaxing the various type of policy of government. Say a greenfield project will get end-to-end 100% automation route. Greyfield project will get 100% FDI through your government route. So these are the things which are being done by the government to make more money available for this sector. But at the end of the day, the money which is made available to this sector will flow through the government system and go ultimately to the capacity building of the institution which are involved in the research. Right. Their number has to grow, their public and private partnership has to increase, more and more product has to come, get IPR and patented, and ultimately enter into the mass scale production, get a clearance for international patent and global marketing. A roadmap has been developed post-pandemic in THR and ICMR. This roadmap requires a lot of the support from the government side so that it can further grow into
You're right. In fact, globally it's been seen that all of the countries that boast of very, very good and robust healthcare sectors, there's a very good understanding between the public and the private sectors. It's a partnership that goes hand in hand. We've not been able to capitalize much on that PPP model. The pandemic, of course, has been an exemplary example of how both sides came together and developed vaccines which ultimately helped the common man. But this model has to be propagated further, has to be carried forward. What are the incentives that we are not giving to the private sector at the moment, because of which they are reluctant in coming in a big way? How are we different from the other countries in terms of,
say for example, the investment which is being done to create a candidate vaccine is extensive. This investment requires either a research done by the labs which are Indian in origin, or having the basic research from outside. So there are various type of riders which are regulatory in nature to enter into a commercial arrangement. They need to be eased out. The second thing is that the capacity building of, say for example, Serum Institute of India. The capacity building is a cost intensive exercise. Now for smaller units, that type of investment is not available within them, and they cannot raise either through equity or from other sources. So there is a need to provide a one-time government support as a form of whatever you call it, the incentive type of thing. Once we provided it as a 10 crore funding for capacity building during the avian influenza time for capacity building of some of the units. So that is the second thing. The third thing is the researchers, the research human resource, they are very deficient and they are not available in India in large number.
That's something that, I was just coming to Dr. Garg, the fact that, today Indian doctors, in fact, our best doctors are providing their services in the UK, in the US. We just had the Pravasi Bharatiya Divas convention. And I was looking at, the background of a lot of these Pravasi Bharatiyas, a lot of our well-known doctors who have gone and studied abroad and never come back. The fact is, we need to have a system wherein we can retain our best talent. Our doctors are serving people of the other countries. Of course, it goes in line with the fact that we believe in the principle of Vasudhaiva Kutumbakam. But at the same time, our best doctors serving other people, but our own people are deprived of the best services, because he said the talent is going abroad because we're not able to retain them effectively. That also hampers the efficiency of the healthcare system. So number one, the kind of incentives and the kind of efforts that need to be made towards that to ensure that our best people stay here and serve their own people. The other aspect is in terms of providing them the best kind of system, the best kind of facilities. Why are doctors serving in the government departments switching over to private in just about 3 to 4 years after serving the mandatory period? So in order to hold them back also.
Yeah, definitely, we need to look at this whole system in a broad perspective. And taking back from where Dr. Srivastava sir said about the research part, I will also say that, when we talk about the research, which is the applied research, we need to also strengthen research. We have got so many medical institutions and all that. And somewhere we never focus upon the operations research. That means plugging in the gaps. We have got different services, we have got different programs which are running. Where are the gaps? Kind of that's where it needs to be promoted. Also, we are only focusing on few institutions. So now, our endeavor has been, to focus to the last mile. Even if the medical college is there in the last, level of, I'll say, northeastern part and all that, and it has not been a good institution, we need to focus on the capacity building with regard to research. Now, coming to your second question, that why people are not able to, we are not able to retain them, that first of all, we need to see that, the basic needs of the individual, the work environment has to be very, very conducive, and we need to come out of our narrow mindset to an open mindset, wherein, I remember the system of, honoraries, which, our own institutions have had, in the earlier times, where people, they worked for the private sector, but in the evening they, came and taught, and the lecture halls or the auditoriums were really full. So kind of, we need to tap on that talent, wherein, people, there are a lot of people across, and I have talked to National Board of Examination, to National Medical Commission. Why don't we have that system wherein people who are, because of several reasons, they could not make to the government, or they could not, be there, continue in the government. So we have a provision where those of them who are interested can give their 2 to 3 hours for the, not only, they are interested, but we also are going to benefit a lot. So that is there. And second is those who have gone out, we must have a provision for them. If they, can come and work, for some time, they can bring in not only the talent, they do help us in bringing the research also, and we can be, not only, I'll say that multi-centric, but multi-country oriented also. So we have to open our channels to that direction as well. So people are interested. It's not that people are not there. People are there to guide also. When I look at, our poor quality dissertations, particularly from different institutions, when we look at National Board of Examination and all that, it always makes us think that we don't have dearth of talent, but it's not that that talent is not there. We always look at only the government part. We have to open our windows, and we have to see that, there's a talent where we can bridge the gap.
Clearly.
And that's what I have made suggestions also personally with regard to that there are many people who will come forward and teach you, and people are coming forward. So something like, positions of adjunct faculty and all that we can give them, and they can come and do our not only capacity building of our young medical graduates, postgraduates, but they can also help us in service provision also.
Clearly, and let's hope these suggestions are incorporated into the system, because when we talk about deficiencies and plugging the loopholes, it's not just about the investment and the funding, it's about the right mindset, channelizing the right skill in the right direction, and a combination of all of this will make our healthcare system robust. So there are certain challenges on the way, but we are hopeful that with the right kind of thrust that this government has provided, there have been several reforms, but of course there's scope for a lot more, given the challenge of a huge population before India. And we're hopeful that the Finance Minister will, increase the budgetary allocation for the healthcare sector this time around. So that having been said, I'll have to wind up the program. Thank you once again to both my guests for joining me on the program today, sharing your thoughts, your views with us and our viewers on the pre-budget expectations, the challenges that our healthcare system faces. But of course, it's a sunshine sector. We are doing extremely well in terms of not just catering to the needs of our own population, but also helping other developing economies, especially in the global south. So let's see how we're able to put more trust, more focus into this sector, and ensure that it grows exponentially in the times to come. So that's it from us on the program today. Thank you very much, viewers, to you for your time as well. I'll see you same time next week now. You take good care of yourselves. Keep watching Sansad TV.